Right, doctor. Lymphomas and leukemias. If anybody didn't prepare for these topics and expecting to get seat in MD, it's a illusion, doctor, let me tell you. So we have a 1.5 hour of review on leukemias, lymphomas, both pathology, general medicine on the online video library. You can review that, but definitely one question will come: CD markers, hairy cell leukemia, everything you must be sure on hematology. Now, CD15, CD30 positive with the whole eyed nuclei. First of all, it is Hodgkin's lymphoma. In that nodular sclerosis, you want to say, because that is the only thing that we know. You know that generally what we will be taught in Hodgkin's lymphoma, there are 4 varieties: nodular sclerosis, lymphocyte depleted, lymphocyte predominant, and mixed cellular pattern, right? But there is something else called, instead of classical Hodgkin's, we have a nodular lymphocyte predominant Hodgkin's. That will be typically CD, this is CD15 and 30 positive, no? CD20 is a differentiator between the two. I leave the literature for you. Now, most common type of NHL in the India is, you must know the subtypes of NHL. Follicular is a wild guess. Any other? Diffuse large granular, obviously the only other possible rescuer. Diffuse large granular. Luckily, your luck goes very well now. So 34% of all NHLs in India are diffuse large B cell lymphoma. What will you not see in megaloblastic anemia? What is your answer, doctor? Beautiful. Classically, reti count will be low in case of megaloblastic anemia. Once more, iron deficiency, megaloblastic, there is no paper. Aspiration pneumonia, it is the bacteria which are the part of our oral flora which constitute the organisms leading to aspiration pneumonia commonly. It is the upper posterior segment which is considered to be the most common segment. This is another dirty question. League, was it there? No. League was not there. I don't know what are the other two. Parkinsonism and nigrostriatal degeneration. But midbrain pons medulla also are degenerative बोल के दिया क्या? Only extrapyramidal basal ganglia only. We don't know what's option. I leave it for the brevity of that's what I mean. I'm not sure. I mean, already it is enigmatic question on the top. We are not sure on the frame. Aplastic anemia, what is accept? Acquired. 5q deletion can't be acquired. Amphotericin B में potassium level 2.3. How much replacement you want to give? First, do you want to give replacement? If so, then below what levels you want to give? Below 2.5 is the indication. How much you want to give? D is the option. The biggest value better दे दिए तो हो जाएगा काम. So the answer is what, doctor? 40 to 100 generally. But if you say 40 to 100, you will kill me. Except D, everything else fall into that. Basically sodium के लिए assessment is more important. Potassium के लिए it's only empirical. And never give it directly. Where will you give it into? You will give it into the drip and make it flow. That's important. Oh, very good. Prashant, our Delhi boy, correctly proposes. MRI symmetrical involvement of what is that? Bilateral striatum, thalami, pons, white matter, and asymmetrical involvement of centrum, semi-ovale. It's a part of the brain. Okay. So 14-year-old with abnormal movement. One thing, doctor, nothing will help you to answer this question except one clue. If I am writing the entrance, except Parkinsonism, 14-year-old unthinkable. Nigrostriatal degeneration also is unthinkable. That Spotts disease, first time I am also listening along with you. Of course, yesterday I read about what is Hollywood and Spotts, but Wilson looks reasonable, but I don't know. We will check that because anyway Prakash asked him to copy that particular thing onto the text. Very good. Now doctor, peanut consumption, edema of tongue, cheapest question in the world. You remember that poem, eat a peanut, call the doctor, the nursery rhyme. You don't? Oh, come on doctor. So what is the most likely cause? Anaphylactic shock. Anaphylaxis with 80/65, what do you want to give? There is only one thing that you can give. Not to be was, oh, not the initial priority was there. Nobody dared to say oxygen is not minimum thing. तो epinephrine तो देना ही पड़ेगा, treatment of choice. So we have to decide between steroid and crystalloid. Which one do you want to avoid? Basically we give antihistamines, steroids, dexamethasone, and also we give epinephrine. So mostly the answer should be then crystalloids. Okay. Now what is the wrong statement in this? How much T-score defines osteoporosis? Beautiful. Osteopenia is 1 to 2.5 and osteoporosis is defined minus 2.5 or lower. Primary pulmonary hypertension, endothelin, agonist or antagonist? Endothelin receptor antagonist, bosentan. Iron deficiency anemia में what is the answer? Tricky question. पूरा भारत में क्या हो रहा है आपको क्या मालूम होगा? Latent होता या what percentage होता? Maybe this is 28%, that is 29%. We don't know. That to negative marks exam. Jaldi bolo. 110. Shrikant is proposing? No. A man of a measure of Shrikant, Satish should not say B. Not in early only thing to fall is ferritin, doctor. Iron doesn't change. Stalwarts like you transferrin saturation less than 16% bole to kaisa doctor. There must be some dharma in this world. Jaldi bolo, right answer. One of the prime definitions is transferrin saturation. Don't confuse transferrin saturation for what is you confused, I will tell you. TIBC? Very good, I know. Total iron binding capacity increases, everything else decreases, that is called iron deficiency. But ferritin does not decrease, that is called anemia of chronic disease. Jaldi bolo. It is not the latent anemia prevalent in India. It is the iron deficiency with symptoms is much more prevalent than latent disease in the case of India, that is according to 2010 statistics. I do not know what happened in 13. 60-year-old male alcoholic with hematemesis, what is the wrong thing? Huh? Common doubt we will have as house surgeon. What are the common doubts we will have as a house surgeon? अगर IV लाइन लगाए तो मीडियन नर्व इंजुरी हो जाएगा, अगर नासो गैस्ट्रिक ट्यूब राइल्स ट्यूब लगाए तो पेशेंट विल गेट कार्डियक एंड रेस्पिरेटरी अरेस्ट टुगेदर. Unless you do 10-20 rails tubes, that still hands will be shivering. Foley catheter लगाए तो bladder puncture हो जाएगा, because you studied about extraperitoneal and versus intraperitoneal rupture of bladder. So now you tell me what is the correct answer. There is no such theory that rails tube will provoke variceal bleeding. Any patient with bleeding, what we will do? First minimum thing is to put a rails tube, right? So that is very, very important, doctor. Gender identity disorder with excellent prognosis. The word excellent qualifies, it is not an understatement. For which condition? Dekho doctor, all our mock tests, what is the rule? There is one topic on that, अगर questions नहीं आए तो MD entrance नामुमकिन है. So what is the topic? Without that we will be starved if that question does not come. A, without testicular feminization syndrome there will be no question paper, doctor, take it granted. Nothing comes to your mind, answer that and come. That will be the correct answer. Best prognosis, testicular feminization syndrome. Painless progressive jaundice, if you listen these three words, what comes to your mind? It should be a malignant biliary jaundice. Why not? Any other option? Alkaline phosphatase also is elevated in her, but the word painless progressive jaundice is an important clue for you to consider obstructive jaundice, which is possibly due to any biliary stricture or obstruction due to malignancy. Antihypertensive in a female is receiving, there is a right hemiparesis, speech difficulty, came in the golden hour of 2.5 hours. BP is 180/100. What is the contraindication for giving TPA, doctor? Systolic more than 185 and diastolic more than contraindication for TPA, diastolic more than 110, systolic more than 185, but she is also in that good range only. Then what is your answer? You want to jump and give thrombolysis with TPA because she came in a right time? Before giving that, what else you want to do? Very good. Non-contrast CT. Why? First you should rule out now वो hemorrhagic stroke है क्या? अगर वो hemorrhagic stroke and you are giving TPA means you are finishing the unfinished job of the god. So that's the reason. Steroids are used in typhoid fever, enteric fever में. Native, any other options? TBM भी दिया क्या? Cerebral malaria. Severe typhoid fever. We give. Patient is in muttering delirium with enteric fever. What stops us from giving steroid will bring a faster recovery. There is an indication. It will reduce the mortality if you give it in severe typhoid. What were the other two options? Any remembrance? Visceral leishmaniasis, dum, then that's all. That much only we have seen in the paper. I know. But you might have widely guessed, no? All four are looking like a visual hallucination. I am there, I am there. You didn't get that feeling. So acha, you jump to visceral leishmaniasis. What was your answer? Malaria. Oh, I don't know, since lot of your stalwarts are saying cerebral malaria, I need to check, but I have not remembered giving cerebral malaria. Oh, you mean to say RMP sinus treatment. What is that? Kisi ko headache hai to what is the reason for the headache? You ask, it is migraine plus tension headache plus brain tumor plus subarachnoid hemorrhage plus bacterial meningitis plus malaria, because he is living in this country called India where insects are there. So there are recommendations, doctor, before you give steroid, you can't give everything. Now aortic valve disease, right hemiparesis, to prevent stroke, what will you do? Beautiful question. There are two things, doctor, primary prevention, secondary prevention. What is the meaning of primary prevention? Not to go to bed itself is primary prevention. After becoming pregnant first time, next time to avoid pregnancy is secondary prevention. What do you want to do in the case of the stroke? Wo bolo. Quick answer. According to international studies, which prophylactic measure is found to have an efficacy? According to recommendation, not personal recommendation. Bolo. Don't give me an innocent answer. Option D. Jindagi tamam low molecular weight heparin lene ka. What do you want to do? 116. Arey, Shanti gives that innocent answer. Give heparin subcutaneously. Jindagi tamam. What else? Abhi is proposing antiplatelet only. Rakesh, na? Your name, doc? Rakesh? What is the answer? Antiplatelet. Simple, doctor. When you are sitting in OP, have you seen the elderly grandpa coming, previously had stroke? Is he coming with acetrom plus aspirin or only aspirin? Okay, na? He is not coming with the warfarin therapy, no? When will you also give anticoagulant therapy? Suppose if he had got any valvular heart disease associated with any dilated heart chamber. For example, you have a mitral stenosis patient, stroke episode is there, it is a valvular heart disease. There you need to give anticoagulation, but not for everybody. So that is the point. I leave to you the literature. Valvular heart disease, how do you manage? So how will, who attaches platelet? Easiest question. Von Willebrand factor. Once more, when you go for All India MD entrance, you will have one question definitely on Bernard-Solier, Glanzmann, Von Willebrand. Risto-Sitin factor, which will not listen to that, which will lead to, in which condition aggregation is seen, in which it is not seen. Favorite issue. Now doctor, neoadjuvant chemotherapy has no role in which situation? PMET tumors. In the PMET tumors, there is no role, because they will be typically chemotherapy is the main part of the treatment. Ab bolo, cerebral malaria में severe malaria according to WHO, not according to you. How will you classify? Simple question, but we will do mistake. I want to know how many of you will do that. Surprise me if you are right. Rakesh. Arey, you already answered this, no? Don't be disappointed if too many went wrong. AIIMS is just 30 people will win when 30,000 people write the exam. But it is what? Rehearsal before the state entrance. Jaldi bolo. Sorry, all except. I am sorry, all except only. What is the correct answer? Super. PCV will be More than 15% or less than 15%? There is a severe anemia. When there is a severe anemia, one of the criteria of the WHO, PCV will be less than 15%. Absolutely right answer. No doubt about it. Manoj thinks it is serum creatinine. Arre, renal failure to main cause why patient of malaria will die. See doctor, a villager with jaundice comes with renal failure. What are the only two diagnoses that will be there in your mind? One is malaria, other is barefoot he walks in the field. What is the risk factor? In this country where you will be doing dialysis, come on, rise up and surprise me. Leptospirosis. Leptospirosis is the second condition. Leptospira ictero-hemorrhagica we say, no, commonly we see Mallaya, Ellaya, they all come with severe jaundice, malaria and leptospirosis. I leave to you in the literature about all these things. Now, no focal neurological deficit. Our favorite question in our regular class mock test. What is your answer? Subarachnoid hemorrhage. There will be no hemiplegia. Why? Because in subarachnoid hemorrhage, where is the bleeding? Bleeding is between meninges, not into the brain. Why should hemiplegia should come? It will not come. But what is one of the complications of the subarachnoid hemorrhage? Blood vessels pass through meninges. That leads to all the blood in the between meninges will irritate them, leading to vasospasm, leading to hypoxia. Then focal neurological deficits will come, like hemiplegia. Subarachnoid hemorrhage per se will not lead to hemiplegia. How will you avoid that, prevent that vasospasm in subarachnoid hemorrhage, cerebral vasospasm? Nimodipine we give. Hydrate the patient very well is the second important principle you should not forget. Beautiful question. 40-year-old hypertensive alternating apnea, hyperpnea, 4 to 5 episodes. What is the next line of management? I know. The only treatment that you know is CPAP. Why will you not answer that? Huh? But we get one more answer as weight reduction. Why? Because you don't know what is CPAP. Why did you choose weight reduction? The only other possibility. 40-year-old obese is also there, no? I am feeling bad. Where is obese? Where is obese? Question number 121. Because sleep apnea mainly occur in obese only. What is your answer? See doctor, for you to initiate CPAP, a very important indication is it should be moderate obstructive sleep apnea or severe, not mild. और दूसरा दिक्कत क्या है कि why they are looking as कोई बात नहीं डॉक्टर साहब, there is a numerical scaling of mild moderate, वो भी बताएंगे. अरे how will I leave you like that doctor? You are all our future top consultants in general medicine. See, 5 to 15 apnea hyperpnea episodes is called mild. 15 to 13 there is a apnea hyperpnea index is moderate. More than 30 is called as severe. So this patient comes under mild where there is no role for CPAP. Hence weight reduction, the most important step. Okay? So that is very good question. AIIMS has proven that it is the top of the country. Now critical illness myoneuropathy, what is true? Some of you are going to be intensive care DM, doctorate in medicine in intensive care. What is your answer? 122? A? Okay, A is a proposal. True only, no? True or accept? This is also an accept question. Accept was there, no? Sorry, mera typing error. What is your answer? Answer is correct only I gave, but I forgot lot of accepts. A. See doctor, critical illness myoneuropathy. Name itself is saying some muscle should be involved, some nerve should be involved. Only examiner is asking a simple question. Oh, cranial nerve hai ya peripheral nerve hai? It is the phrenic nerve which is involved, peripheral nerves which are involved, diaphragm is involved, diaphragm get atrophied. See doctor, if you intubated any patient, right, you have managed the patient who has undergone intubation on a ventilator for some period of time. After that you have extubated, ultimately you discharged and sent him home. But even if you intubate for 4-5 days also, right, diaphragm become lazy. Normally its job is what, 12 times every day it is supposed to work. Even if you are preparing for MD entrance, sitting in a reading room without moving your limbs for few days together, diaphragm will be moving. But if you intubate a patient and put him on ventilator, that 4-5 days of non-activity is sufficient to lead to diaphragmatic atrophy. That's the reason post intubation patient will have ventilatory problems because of that. But about 50% of the people who suffered critical illness myoneuropathy after ventilation will recover. That's a good news, right doctor? So it is not cranial nerve, it is the peripheral nerve which will show histological changes is what need to be basically remembered. Now, spine, chest, abdominal injury में bradycardia से आया. So do you like to call hypovolemic shock or anaphylactic neurogenic shock? Bradycardia is a classical example of both. Why both? Oh, okay. Hypotension can be explained by neurogenic shock. No, maybe both can be a right answer, but I did not get a clue. Any other thing is there given in the question frame to make you to think it is hypovolemic? Yeah, abdominal injury is a internal bleeding. Because of blunt trauma there can be development of a splenic injury which can lead to hypovolemia. Same time, due to hypovolemia you expected tachycardia, but because bradycardia is there you thought it as neurogeny. That is a reasonable way of thinking. Maybe that is what examiner is thinking, I do not know. Now one more question. Sudden severe headache, becomes unconscious, upon regaining the conscious develops photophobia, neck rigidity. What is the diagnosis in your mind? Sudden severe headache 2 hours ago and become unconscious, upon regaining consciousness, photophobia, rigidity. 2 questions on subarachnoid hemorrhage, how important it is a topic. So what is the first investigation you want to do doctor? Non-contrast CT, simple to identify the, what will you see on a non-contrast CT? Sylvian fissures may there will be bleeding in the non-contrast CT when there is subarachnoid hemorrhage. I did not get time to add images. 32-year-old Bengali female, 3 days of fever followed by 2 episodes of seizures comes to you. What is your answer? In a young adult presenting with fever with seizures, you think which important entity? RMP sinus diagnosis, malaria plus viral hepatitis, I mean viral meningitis, everything. What will you think? 125? HSV encephalitis is what you need to expect, even though they are immunocompetent. So IV acyclovir become the first line of management. For me to give mannitol, I am not seeing any signs of raised ICT or anything. Now, according to AHA guidelines, which is removed in fact from CPR, atropine. If atropine is given, generally what will you expect doctor? Heart rate to come back, right? So as a house surgeons we might have given liters and liters of atropine. Already patient died last night, until your night duty is over and the next house surgeon takes over, on that cadaver middle you will be going and giving atropine into the heart. So that is called overcoming the CPR psychosis. So yeah, as house surgeons we all did that. Now that is removed, the new guidelines you can review, but let me tell you, ACLS and basic support, definitely one question commonly asked any exam. Tension pneumothorax, what is the cause in India as a house surgeon for tension pneumothorax? Where will you see? If you are working in a rural setup, relatively rural setup, nowadays medical colleges are all in rural setup. Bull hitting a villager with the development of a rib fracture leading to pneumothorax, which is causing ball phenomena leading to tension pneumothorax. What will you do? Have you not done any time? Insertion of the needle into second intercostal space is the first thing that you need to basically do. Very good, doctor. Glasgow Coma Scale. Be happy and thankful to them, examiner. Why? He didn't ask you Apache score. Or he didn't ask one of the criteria in the 48th hour criteria of the Ranson's list. Only he asked Glasgow, which you commonly practice. Bolo, what is the answer? Typically it is M4. I leave the literature for you. Oh, sorry. Lennox-Gastaut. I was listening, lot of people saying rufinamide. Have you checked that? Newer anti-epileptics. One question on anti-epileptic is a rule. Rufinamide. So, doctor, I leave the literature. First line treatments, conventional wisdom. Valproate, benzodiazepines. Effective on the basis of a open labeled but uncontrolled trial, which is not very strong evidence. Bigabatrin and zonisamide, because uncontrolled trial. Uncontrolled trial बोले तो क्या है? The medical rep told, sir ये 10 drugs are in your patients, this is a very good drug बोल के आप एक interview दे दो, आपका Paris का ticket ready करूँगा. So uncontrolled trial it is, right? Then treatment proven by double blinded trial basically is considered to be more evidence. In that rufinamide, lamotrigine, topiramate are all mentioned, right doctor? So based on this discussion, now which is not a coarse tremor, what is your answer? You want to say general paresis. How about alcohol? Have you checked? Alcohol tremor. Parkinsonism, thyrotoxicosis, so patient will be slapping you only with the tremor. It can't be fine tremor. Ab bolo. Alcohol and general paresis. Oh, it was given of tongue was given. Oh, if tongue is given, then it's more likely to be your general paresis becomes the correct answer. Okay, agreed. Regarding hemoptysis, what is the correct answer? Bronchoscopy and chest radiograph, they are the main investigations. When will you do bronchoscopy? If the chest x-ray is not showing any abnormality, bronchoscopy. Otherwise, chest x-ray is the simple way. TB, malignancy, common causes of hemoptysis can be identified. Right flank pain, 10 days of ventilation, gas in the portal vein, which necrotizing enterocolitis. Very difficult, doctor. You answered means you answered this correctly, but Glasgow Coma Scale wrong means definitely paper out ho gaya. So ek bada table hai doctor. Don't worry. If this comes, no one will answer. That be necrotizing enterocolitis may classification too much. And don't tell your classmates. Very important question. अभी अभी वो पढ़ना शुरू किया, शुरुआत में ही इतना बड़ा बड़ा 4-5 टेबल देखा है तो भाग जाएगा बेचारा. So unless you are very angry on him. Altered bowel habits, mesenteric fat dilatation, fat, and dilatation of proximal distal ileum. On telephone only, what is your diagnosis about this? What will you say if you listen it on a phone? In this country, ileocecal TB. Ulcerative colitis and Crohn's also are the possibilities given the history. Unlikely to be due to ischemic bowel disease. There is a different type of presentation. Primary idiopathic bladder stones. Today only I came to know there is an entity called like this. So I gave a call to my urology friend Satish. There is one more Satish, urologist in Tirupati. Oh, that's a superb MCH standard question. Maybe it slipped from the question bank and dropped into the undergraduate this thing. So what is the answer? Expert answer. Jaldi bolo. When I myself heard first time, where will you answer? But kuch guess maro. Dekhenge who is good in parroting the answers. Never recurs after the surgery. Ek bar nikalo, that is the end of the story. That is the speciality of endemic bladder stone. Scivora means spinal cord injury without radiographic abnormality is a typical entity in itself in radiology. This also I came to know first time today. Thanks to all of you to make me prepare for this session. Children, it is. Otherwise also you might have answered children, right? I know. Why did you answer children also? I will tell you. You might have thought spina bifida mein outside nothing is seen, but inside something is there. That's a common expectation. No problem, right or wrong, innocence wins. Now 60-year-old PSA 7.5, prostate is tender, diffuse back pain. Classical question. यूरोलॉजी में आखिर क्या है डॉक्टर? 3 चीजें हैं, BPH, prostate cancer, prostatitis. इन तीनों में you have to catch which finger you want to catch. What is your answer? It is prostatitis. So what is the treatment? First choice. RMP only will start antibiotic for an infection. Why will you not start? So antibiotics, very good. Contaminated necrotic wound, what is your answer? First, second, third priority is also debridement. Burns patient, curling ulcer, where will you find it? Beautiful, that should be the style. All 200 questions, if you answer like that, I will be very happy. Disaster triage, which is given preference? Common sense, if you know driving car, you can answer this. Red light aa gaya to stop and take care of the guy. Black expectant, red immediate, yellow observation, green wait, white, they are also white. Dismiss, army rules. This is disgusting question, but we had it in one of our Saturday subject tests in surgery. More than 50. Maybe I thought some answer में गलती है. क्यों? What is the सच्चाई? Symptomatic chaotic aneurysm, if you do surgery, doctor, mortality rate is 26%. Asymptomatic, if you do 5%. Rupture होके surgery करे तो 35%. ये percentages पे आप decide करो. Now, couple on treatment for fertility, lady is normal, SAR is abnormal. अब बोलो. Quantity of semen is 0.8 ml. It is not USMLE. In USMLE they will also give normal values. Here you are expected to know. On 2 repeated samples. Transrectal ultrasound, what do you want to discover, doctor? Transrectal, what will you see? Before putting something into rectum, no, you need to give some confidence to the patient, no? You have to warm your hand and do minimum clinical examination. What is that clinical examination you have to, doctor? directly if you say transrectal ultrasound means ST segment elevation आएगा. So what is the entity? What is the entity we are talking about? There is an entity called CBAVD. Don't think ABVD regime, that's different. Congenital absence of bilateral vas difference, which is better than congenital absence of corpus callosum. So because of that, the tap is not opening up, semen quantity is very little, heights of dehydration, and fructose is negative. First thing, minimum thing क्या करना, local examination करके vas को check करना डॉक्टर, बाद में transrectal whatever you put he will say okay. That's very important, right doctor? Right, don't tell. Murali Bharadwaz teaches like this, but life is miserable sometimes. Now maximum cardiac output 28 or 32? 32 is not happy, because I called my cardiology guy and asked, pregnancy में आप कभी CHF देखा तो 32 to 34 is a common time. Some statistics say 32, 34 is the maximum time, but Indian books say 28 weeks, rule of 5. So that way 32 if it is not there, 28 is the happy answer, that's good. But once more, physiological changes of pregnancy, very predictable question. Question number 143, most accurate and safe 6 weeks amenorrhea. Nobody thought Doppler? Doppler is not popular. Ultrasound? Yeah. What will Doppler will show? Flow velocity in the vessels, no? That is not what we are checking. During pregnancy, what is abnormal? Huh? Engorged neck veins, pregnancy or no pregnancy, anytime abnormal. Whereas pedal edema, exertional dyspnea, don't jump and say you have heart disease, heart is out. Don't tell. Female primary amenorrhea, what is your diagnosis? Classically, Turner. What do you expect in Turner? Streaky gonads. That's the reason. Primary ovarian failure, loss of oocytes is what you typically come across. Very good. Today we have students all the way from Yasser Arafat in JK to Santosh in Kerala, a full spread of our classmates. I am very happy to see you all today. At 20 weeks of gestation, cervix, this is also very standard. 30 out of 30 you should get in obstetrics this time. One question on abortion nahi hai, to cervical os closed, opened, products passed, not passed, definitely question will be there. Huh? So it is open, considered inevitable or incomplete. But since she did not pass any products, answer becomes inevitable. Right doctor? So we have reached this point in our MD preparation now. November means product is not yet passed but os is open kind of a situation. There is no way that you can take back. Rise every day, full confidence, full energy, go back to the reading room and prepare for the exam. Only thing that should happen is delivery of products of conception. So no regrets. Array, maybe I would have not become pregnant I would have not thought of preparing for exam. I wasted my time. Bullshit, forget it. Already you are pregnant, you are carrying SPM, ENT, ophthalmology, everything. Deliver and come successfully. Right doctor? Fallopian tube part, which is anatomical sphincter, very simple, which is a part of a muscle. Intramural, that's right. Pregnant lady, mild hypertension, parasagittal hematoma. What is your answer doctor? What is your answer? I know what you are lingering between. Intracranial hemorrhage versus sagittal vein thrombosis. Nobody thinks eclampsia, no? Anybody? Because there is no proteinuria. What's your answer? Abhilasha is proposing intracranial hemorrhage, very good. And Vikas is saying sagittal vein thrombosis from Patna in Bihar. Yeah, Rakesh, what is your answer? Intracranial hemorrhage. But doctor, is there any predisposing factor for intracranial hemorrhage? Is pregnancy, is it a predisposing factor? But pregnancy is a predisposing factor for something else. Thrombosis. Agar thrombosis aithe, why there is a bleeding is your question in the mind. Basically, hemorrhages typically develop in close proximity to the major venous sinuses. Parasagittal hematoma hai to supersagittal sinus thrombosis. Superficial postular temporal hematoma will be there if there is a transverse sinus thrombosis. So that is the reason answer is sagittal vein thrombosis, which is not a risk factor of cervical cancer, endometrial cancer, ovarian cancer. Without that there is no obstetrics. Jaldi bolo. High parity is a risk factor, not a low parity. Vacuum versus forceps, what is the main difference, doctor? Huh? You like to say? D? D? If given a chance to guess something else. Cephalohematoma? Very narrow gap, but definitely vacuum, forceps, differences. Obstetrics is very predictable, doctor. You are doing wrongs means you have disregarded your labor room postings. Huh? Both Ghai and Datta, sorry, Shah and Datta will come into your sleep as ghosts to see that why did you not study them. You have to. I leave the literature for you. Towner and colleagues have done a landmark paper. Neonatal intracranial hemorrhages, basically 1 in 334 with failed vacuum or forceps, 1 in 664 with forceps, 1 in 860 is vacuum. Between 1 in 664, 1 in 860, which is bigger number? One in? Between the two. 1 in 664 is more common incidence. It is more common in forceps, not vacuum. Remaining all in vacuum. This question I could not get time to check the answer. You need to, it's available in the last pages of the Shaw. 30-year-old hirsutism, infertility, PCOD. Which is not used in the treatment. Tamoxifen we don't use. Oh, I think easy question. Then post lumbar puncture headache. Tell me, doctor, what is your answer? All these things are used except one thing is considered to be outdated practice. Closed toilet. I still could not understand what is closed. I called Sunil, who is our top consultant anesthetist. Huh? I know what is toilet, but what is this closed toilet and what is its role? That's what I could not understand. But one of the common practices, remember, is earlier school of thought is prophylactic crystalloid solutions were considered to be good. Later on, lot of studies said, what is this nonsense of overhydrating the patient, throwing the patient into pulmonary edema. Don't do that. You check 10 people with and without, there is no difference, it is only a placebo effect. So crystalloid solution they stopped. But recent protocol, once more, whatever Sunil, who is a top anesthetist in Hyderabad, says is perioperatively, it's called as not prophylactic, but it's called as at the time of surgery you keep giving fluids to prevent post operative headache is the new protocol. So I think D should be answer. maybe A, I do not know what it is having a role, we will check that. To close stylet before withdrawing the needle so that few drops do not fall down of the CSF fluid, so that you will prevent fall of the CSF pressure. That is the thought, no? Okay. I think D, we will check that. Oh, doctor, this question you answered means you understood pharmacology principles in anesthesia textbook. Jaldi bolo. Agent with high blood gas solubility. What happens? See, whatever the anesthetic gas which you have given, if it goes and dissolves in blood, it don't like to go to brain. No use. So high blood gas coefficient है तो solubility coefficient slow हो जाएगा induction. और एक बात बोलो. Abhilasha, Mahesh, Neha, Swarupa, Harika. Everyone is saying B. Superb. Second gas effect it is called as. So nitrous oxide, what will it do, doctor? It will basically, it is not soluble in the blood. So its rapid absorption in alveoli will cause a rise of the alveolar concentration of the other inhalational agent, so that induction become faster. That is the idea. I leave the literature for you on the remaining, how will right to left shunt will affect, how will residual volume will affect induction. Two questions, doctor, favorite questions of examiner in anesthesia. MAC value, factors affecting, unaffecting, decreasing, increasing, decreasing, unaffecting. The MAC, one question definitely will come. Then second thing is all this story. Tubocular, which muscle will get affected first? Jaw. So basically it is the jaw muscles, levator eyelid muscles, and the muscles of the head and neck. Very simple. One day also you go to operation theatre, you will know answer this. After giving the muscle relaxant, what will anesthetist will do? He will set the jaw and push the ET tube. So in a patient with history of seizures, which one will not be safe? You think ketamine, propofol both are given? Propofol is also given. Oh. Doctor, there are two important things in this. Propofol is also considered to be the one which has a potential chance of causing seizure activity. So anesthetists will be careful to not give propofol. But in clinical practice, ketamine also is avoided if there is a seizure history. So we need to check the two, we need to recheck that. This is a simple question. What is your answer? T? 8. Almost up to just above the umbilicus only you want to anesthetize and do cesarean, or you want it to spread up to the nipple line while doing LSCS? Because the uterus itself has gone above the level of that, no? Fully gravid uterus. So below that level if you anesthetize and wanted to do incision means baby will not agree. So what is your answer? T4 is an answer coming from an anesthetist. And T6 is preferred if it is hysterectomy like surgeries which involve pelvis, not a gravid uterus. Gravid uterus it must be little higher, T4. Neuraxial block, one of the standard question in the exam, not a contraindication. What is your answer, doctor? D. Because lot of our patients keep taking BP tablets. If that is contraindication, to no one we can give spinal. That is the logic, right? So then there is a wheezing after doing laparoscopic cholecystectomy. What is used in the treatment? I don't know what else was given by the examiner. You want to give? Beta agonists or bronchodilators which are available. So beta 2 agonists you want to give? That's the physician's answer. Why they should give an anesthesia such a question? Laparoscopic cholecystectomy, whenever you are doing lot of times, if the plane of anesthesia is superficial, you find patient going into bronchospasm, very common in the clinical practice. Okay, doctor. Deepening the plane of anesthesia is the anesthetist's answer. I am not sure. I don't have literature to support that. His answer is practicing anesthetist's answer, deepening the plane of anesthesia. As a physician, anybody with common sense will say give bronchodilator. But you need to be sure. Now, drug causing malignant hyperplasia? Suxamethonium. I don't know what were the options of this question, I skipped that. Child not eating leafy vegetables, mom is saying eat chocolate. What is chocolate acting as? Operant conditioning. That's, you give a reinforcer. Then if conditioning occur, you call it as operant conditioning, right? But classical conditioning means we take mock tests between 9 to 12 because actual exam is 9 to 12. So whatever mistakes we do in mock test, we will also do there without feeling any anxiety or tension. So that is the purpose of taking mock tests, but please come for our mock tests. So female 16 years, abdominal pain, bilateral loss of vision, everything without any neurological examination. We are all experts in that, especially when there is a night duty at an unexpected time when we are on a date. Now, patient 15 years alcoholic, rum fits, alcohol withdrawal, that would be diazepam, benzodiazepine. Overhanging erosions means what comes to your mind? Only one condition causes over, that too first metatarsophalangeal, big toe, gout. Easy question. H type of TEF may, what will you do? X-ray was also there. X-ray was also there. Okay. So how will you diagnose looking at X-ray? But it is a H type. Trachea, esophagus are going straight, only somewhere there is a link. Bronchoscope also will go straight, it don't know how to see right and left. So no bronchoscopy, no endoscopy, but CT can see, contrast enhanced CT. Except was there? X-ray may, I don't think. Yeah, then increased pulmonary blood flow. Radiologically, what are the indications that accept? So this today's discussion we will upload it into YouTube. You can tell your classmates who missed the discussion to catch up on youtube.com/onlinembbs. Yeah, tell me doctor, what is your answer? Interesting question. Lung is there doctor, blood is coming inside, blood is leaving the lung. Whatever is leaving is pulmonary vein, what is coming in is pulmonary artery. Your option A, C, D, everything are talking about what? Pulmonary plethora, which is increased blood flow to the lung. Curly V lines, interstitial edema in CHF is due to pulmonary venous hypertension. So it does not indicate there is an increased blood flow. Simple, if you know what is coming into lung and leaving lung, you can be a gang leader. Now contrast nephropathy, I think, is it the same question? Oh, contrast nephropathy बोल के high serum creatinine नहीं रहे तो क्या रहेगा? Was it the question? Examiner want to give you some relief because after finishing exam you need to travel back to Hyderabad, no? So At least you will tell everybody, oh AIIMS question I did correctly, that too high creatinine nephropathy. Nephropathy में नहीं है तो encephalopathy में होता क्या? Then probably in the train you will meet a guy who thought it as encephalopathy. That is at least a feeling. Oh, I am little better than that guy. So full form of fast is what? In trauma. Ultimately in trauma आता. Oh, और एक in trauma है. Okay, okay. Yeah, I think you know the full form. That's a easy question. Disc and also vertebral body. Classical question. Intervertebral disc and also vertebral body. दोनों involve है तो क्या है? Intervertebral disc sparing है तो क्या है? हाँ? Simple doctor. Paradiscal TB. Upper half of the lower vertebra, lower half of the upper vertebra, they all have a common embryological origin. They share a similar blood flow. So whenever TB comes, it will affect upper fellow, lower fellow, middle ka, intervertebral disc fellow. All the three fellows are involved. TB. M mode stratosphere. My friend Krishna, Dr. Krishna, top radiologist, chief radiologist. I gave a call at 4:30 evening. Krishna, do you know what is stratosphere sign? What is this? He did a fellowship in US, and one of the most successful radiologists of the twin cities of Hyderabad. Stratosphere means what? Are you asking me something about ozone layer or something? You bring the MRI, you bring the patient, I will discover pneumothorax, but don't ask me all these signs. If a top radiologist don't know who is as good as a professor, so pneumothorax mein, if you do ultrasound M mode doctor, what will happen? Basically, there's a lot of story in this. You need to review that. I leave the literature. Basically, pneumothorax mein lung is compressed, air is filling between visceral and parietal layers of the pleura, right? So that visceral layer of the pleura becomes so close with the what you call the lung tissue, that when you compare the parietal blown out pleura, visceral pleura and the lung tissue compressed, they look like on a M mode ultrasound as a stratosphere. That's the idea. Anarchia. This is the most controversial question of the entire exam. Best investigation. That's what. Like patients will tell you, no, doctor अच्छा treatment दे दो, doctor अच्छा investigations करो. That means if a patient says that emphatically, what does he mean? He want a CT scan or MRI urgently, because his co-brother also had a CT scan, his co-brother had an angiogram, why he will not have? So 10 times he is asking you, अच्छा treatment for my heart attack doctor, then you should order for a coronary angiogram, indication in India. Yeah, jaldi bolo. Any day laparoscopy. Ultrasound, what will the report will come? Scrotal bag seen, but nothing seen inside. Correlate clinically. Then you will do CT scan. CT scan will say scrotal bag which is surrounded by muscular planes. Oh, that is MRI report. But we could not know where is the testis, who took away the testis. Clinically correlate. Urologist will be holding his head and sitting. Best is laparoscopic karke search entire abdomen without any further clinical correlations. So actually we gave answer B, but correct it. Urologist's favorite answer is laparoscopy. That's right. TB treatment may altered sensorium, what is the test not done? Was it the same question? Yeah. Jaldi bolo. Altered sensorium, who is on ATT. TBM है तो किसी को altered sensorium आ गए तो दो चीजें रहते डॉक्टर, एक hydrocephalus may develop as a complication due to the arachnoid granulations got fibrosed, or it can be because of hyponatremia which can develop whenever there is any intracranial lesion. Altered sensorium हो सकता commonly in the clinical practice. Maybe examiner want to know that he has a hydrocephalus, raised ICT, in that time also will you put a murderous lumbar puncture into the spine of the patient or not, is the question. After all, why do you want to do CSF? Don't tell, to discover malaria. So that's the point. So thanks doctor for a patient attendance, quite a long time. I really enjoyed the session. Thank you.